is going to be a nice little interview with Dr. Tyler Johnson. So, Tyler, tell us a little bit about yourself. Who is Tyler Johnson?
Well, I'll tell you what, I graduated from Iowa State in 1995, and then from there I went on to Palmer College of Chiropractic and graduated in 2002. Went on to Arizona where I practiced for a few years and worked on pro athletes, and then about 3.5 years ago I moved back here to the Quad Cities. And I brought that knowledge of treating pro athletes back here to the Quad Cities. Now I'm more of a family practitioner, but we do specialize in sports injury and work injury. I think that's about it. I don't know.
Okay. Tyler, I know you've got an ART shirt on, and I'm familiar with ART, but why don't you tell your viewers, what is ART?
Well, ART stands for Active Release Technique, and what that is we break up adhesions between fascia and soft tissue. And what fascia is, it's a saran wrap around your body. And soft tissue is muscle, nerve, ligament, or tendon. So what happens is adhesions form between the soft tissue and fascia, and we break those two up. Now we have increased range of motion, decreased pain. And that's the gist behind ART.
Okay, excellent.
Yeah.
So Tyler, why would somebody go to you versus every other chiropractor out there in the Quad City area here?
Mm-hmm. Well, besides the adjustment, we work with the soft tissue, and if we adjust sometimes and the soft tissue is not tender or working the way it's supposed to work, what will happen is that adjustment just won't hold, so it'll take longer to get you better. What we do here is we actually adjust along with the ART, so we break up the adhesions or scar tissue within the soft tissue or muscle, and now that muscle can work the way it's supposed to, that adjustment will hold like it's supposed to, and now you get better faster. So we see people in our clinic here getting better in half the time as if they were just getting adjusted only.
Okay. Tyler, would you recommend ART for more than just athletes? Would that help a working mom?
Yeah, exactly. ART is great for any population. So it's great for athletes. It's great for the computer worker, the manual laborer, the mom that has to lift her kids on a regular basis, the stress from being a mom. So yeah, it works on various people.
Okay, excellent. So if you're an athlete, how can ART help you as an athlete?
Well, as athletes, we train, and when we train, it's a consistent pounding on our joints and our muscles. And over time, with that overuse, scar tissue builds up, or adhesion builds up between the fascia and the soft tissue. So then we get injury along the way. So what we need to do is we actually need to break up that scar tissue as much as we possibly can so we can increase our performance or have an optimum performance, and so that at the same token preventing injury down the road.
Tyler, what should somebody expect? How many visits using the ART before they start to really feel some difference or see some results in their either range of motion or performance?
Yeah, typically it depends upon the person, how old you are and that sort of thing, how long you've had the injury, but typically we see after about 5 visits we see a nice change. And then past that, we kind of can determine how long they should come after the 5 visits. But normally about 5.
Okay, excellent. Right. Good job.